Dear colleagues, I am very glad to welcome you to this course organized by the company UDUS. Today, I would like to tell you about the personalized approach to the treatment of central series Fourier retinopathy using the Navilas 577S navigation laser system. Let me start by saying that CSC is usually found in young working age patients. This is why it is important to use the most careful, function-sparing and tissue-preserving laser treatment techniques. The Micropulse mode is widely used for the treatment of CSC. The advantages of a Micropulse mode is the possibility of targeted impact on the APE. Thermal damage of the adjacent structures, the retina and choroid, is undesirable and is a negative side effect of the treatment. Treating CSC with a Micropulse mode poses two key problems. The first one is selection of the energy parameters of a Micropulse mode on commercially available laser systems, taking into account individual characteristics. The second problem is correct application of laser spots. Then examine the ocular fundus in clinical practice. It is difficult to visualize the APE defect or detachment corresponding to a leakage. Application of laser spots is not visible. Then choosing the parameters of a Micropulse mode in the treatment of CSC, it is important to observe two conditions. Let's consider each of them. The first condition is to determine the window of the Micropulse parameters with a selective effect on the APE, taking into account a particular laser system's technical capabilities. The other one is to select parameters for a particular patient, taking into account their individual characteristics. To do this, a computer simulation of the laser radiation effect on the eye tissue was performed. It was done in two stages. At first, the temperature distribution was calculated as a function of time after exposure at a different Micropulse power. After that, the Arrhenius integral was calculated in order to estimate the concentration of denaturated protein. As can you see from this slide, Zone 1 reflects the extent of damage to the adjacent structures outside the APE, harmful effect. Zone 2 is denaturated protein in the APE. Zone 3 is undenaturated native protein in the APE. To quantify the damage of the APE, the concept of efficiency was introduced. The efficiency is the ratio between the amount of denaturated protein and the total amount of protein within the APE layer. To quantify the quality of the target damage of the APE, the selectivity concept was introduced. The selectivity is the ratio of the amount of denaturated protein inside the APE layer to the total amount of denaturated protein. A computer simulation was performed for the modes of the Navilas laser system with a different number of micropulses and micropulse duration. The modes that fall into the window with the highest selectivity and efficiency values are highlighted with a green rectangle. Under this condition, the targeted effect on the APE was consequently achieved with minimal damage to the adjacent structures. The Micropulse mode, with a Micropulse durations of 50 microseconds, 2.4 duty cycle, 10 milliseconds pulse envelope, results in selectivity and efficiency values of greater than 67% within a certain range of Micropulse power and is preferable for use in the fovea avascular zone. The Micropulse modes can produce a selective effect on the RPE in a narrow range of parameters values. An increase in the micropulse duration, duty cycle, and number of pulses leads to a decrease in the selectivity. Then comparison this micropulse mode with a micropulse duration of 50 microseconds, 2.4 duty cycle, and 10 millisecond pulse envelope, 5 pulses, with the continuous wave modes with a time duration of 10 milliseconds and power 50 milliwatt, it can be seen that the harmful effect to the adjacent structures outside the RPE is almost 5 times less. On this slide, you can see that the continuous wave modes leads to the same damage to the adjacent structures as the micropulse mode with parameters 5 microsecond time durations, 5% duty cycle, 0.1 seconds pulse envelope, which is widely used in clinical practice. For selective damage to the RPE, it is important to take into account the individual characteristics of each patient. The computer simulation performed has shown that changes in the transmission and absorption coefficients affect the values of efficiency and selectivity. The dose of laser radiation absorbed in the RPE depends on the distribution of pigment granules and the concentration of melanin. The light transmission coefficient decreases with age. The melanin concentration also decreases. Therefore, for a person with transparent optical media and a high concentration of melanin, a power lower than the calculated value is required, and vice versa. To select the minimum energy parameters, it is necessary to perform the micropulse mode testing and evaluate the individual tissue response. The most sensitive diagnostic method of the RPE thermal damage is shortwave autofluorescence. The parameters of laser treatment were selected individually by testing based on the use of the minimal power at which laser spots were visualized using autofluorescence. The next important point in the treatment of CSC is correct application of laser spots. Laser spots should be located close to each other, covering the entire area of defects and detachment of the RPE. Morphological changes in the RPE are determined using fluorescent angiography and angio-OCT in the in-phase mode with a clear localization relative to the vascular network. Let me show you these two diagnostic methods in action. As can be seen from this slide, both of them are informative and can be used to diagnose morphological changes in the RPE. The diagnostic results, superimposed on the color photo on the fundus, are imported into the navigation laser systems, and a treatment plan is created by placing laser spots on the areas with morphological changes in the RPE. Afterwards, targeted topographically oriented treatment is carried out. 31 eyes of 31 patients with central serous chorioretinopathy were treated with the micropulse mode of the Navilas laser system. Parameters were selected individually. Patients with multiple extensive diffuse RPE defects, RPE atrophy, or any other signs of chronic CSC were included from this study. Each patient was followed up 2 weeks, 1, 3, 6 months, and 1 year after laser treatment. And now let me give you some statistical information. As can you see, after treatment, visual acuity and light sensitivity increase and central macular thickness decrease. Subretinal fluid was eliminated in 29 eyes within a period of 3 months after treatment. Recurrence occurred in 2 patients for 1 year follow-up. Laser spots did not cause any scotoma according to the microperimetry, and no evidence of photoreceptor damage was observed on the OCT. This slide demonstrates a CSC with the RPE detachment, which was diagnosed using angio-OCT in the in-phase mode. Laser spots were applied to precisely cover the RPE detachment. After 2 weeks, the RPE detachment was absent, and after 1 month, complete resorption of subretinal fluid was observed. Here you may see an example of a CSC with RPE defect found using angio-OCT in the in-phase mode. Laser spots were applied to precisely cover the RPE defect. After 2 weeks, the RPE defect was closed, and after 1 month, complete resorption of the subretinal fluid was observed. This slide presents a clinical case of a patient with CSC with a sufficiently large detachment of the RPE. To determine the localization of the RPE detachment and create a treatment plan, fluorescein angiography was performed. The treatment protocol is shown on this slide. As can be seen before treatment, there was a decrease in light sensitivity in the area of the detached retina. 2 weeks after treatment, the RPE detachment was absent, and there was a significant increase in light sensitivity. In a month later, complete resorption of subretinal fluid was noted. 3 months after treatment, there were no visible changes in the testing and treatment area according to the fluorescein angiography and autofluorescent data. Now let me briefly summarize all the above said. The Micropulse mode, 15 microsecond 2.4 duty cycle, 10 milliseconds pulse envelope, 5 micropulses, has efficiency and selectivity values of greater than 67% and correspond to the optimal therapeutic window for targeted RPE damage at a certain power. Testing of a micropulse mode allows taking into account the individual characteristics of patients, such as transparent optical media, concentration of melanin in the RPE, and conducting treatment with minimal parameters. The use of navigation systems allows one to apply laser spots precisely to the areas of defect and RPE detachments according to a CSC treatment plan. The conclusion we have come to is as follows. Personalized laser treatment of central serous chorioretinopathy using a micropulse mode with individual selection of parameters based on the computer model on the Navilas laser system has demonstrated efficacy and safety, especially in the case when the RPE leak is located close to the fovea. Thank you for your attention.